Great. Well, hi everyone. My name's Alice Rhoda-Bartlink and I'm a senior lecturer at the University of Tasmania in the Wicking Centre. And today I'll be presenting a webinar for you to also explain to you a little bit more about our offering of a Diploma of Ageing Studies and Services, and we'll explain all that in the webinar. I'm also supported by a bit of a team today. I've got James, Claire, and Anthony here today. Thank you guys for joining us as well. They'll be attending to your questions in the chat. Which you won't be able to speak in this web tutorial, but please feel free to utilise the chat for questions or any observations or comments that you'd like to add. And James and Anthony will be responding to that. Claire is also here. She's a big organizer of everything. Thank you, Claire, for getting this happening for us today. So I'll get started with the sharing the PowerPoint. You will have access to this PowerPoint presentation afterwards, the slides, which some people really love slides, and so you will be able to access your own copy of these as well. Here we go. Let's have a look at chronicity and aging, and hopefully this will be able to support you in being able to recognise chronic conditions in the older population and maybe older people that you're personally supporting. First of all, I'd like to acknowledge the traditional owners of the lands upon which you are listening to this webinar from. For us, it's the Lutruwita people of Tasmania. And the Lutruwita is the land of Tasmania where we are presenting from. And the Palawa people are the custodians of this land who've been caring for and protecting country for many thousands of years. I pay my respects to elders past, present and emerging, and to any Aboriginal and Torres Strait Islander people who may be joining us today as well. So as an overview, there's a lot of content to present to you, and I had to be very mindful of trimming things down because essentially the content of what you're listening to today constitutes a subject or a unit that's presented in the Ageing Studies and Services diploma called Chronicity and Multimorbidity. And there's a lot to unpack in this, and that's why we thought it might be useful presenting it as a webinar. So it really is designed to just give you a little bit of an insight into recognising the significance of multiple chronic conditions in our older population and understand how much it's influenced by the impact of stigma. Also identifies some commonly overlooked chronic conditions and what would happen if, or what's the potential that could happen once these conditions are overlooked, and also to enable you to feel more confident in actively engaging family caregivers. We've got a little case study which I just want to present to you just as a food for thought, and then we're going to give you some go away tips with some approaches to holistic care for the older population. So you might be asking yourself, so what? What happens if we don't recognise chronic conditions? And essentially, by not recognising chronic conditions, that you really are missing opportunity to maximise a person's long-term health opportunities. You are also with underlying conditions being unmanaged, you increase the risk of complications and things escalating to acute health conditions, and then perhaps requiring hospital care as opposed to being managed at a local level by a GP or other health services. You have the potential for the person to have reduced functional independence, so therefore they may have increased accelerated aging, physical and cognitive decline, and also it places greater stress on caregivers and family members, and then also it can lead to a loss of trust in the health system, and we'll go into that in a little bit more as we progress today. Now, Let's look at a little bit of the terminology. Chronic diseases essentially are any long-term health condition that a person develops. Usually it develops slowly and it persists for many years or even for a lifetime. And it usually requires sort of ongoing management rather than a one-time cure, like an infection that gets a treatment and then it's gone. These are more sort of long-term, insidious type of conditions. Multimorbidity is essentially multiple chronic conditions existing at the same time, and usually the presence of two or more chronic conditions. As we'll see in a moment, that you'll see that it's more common for older adults to have to experience multimorbidity, and the symptoms and complications of chronic disease can contribute to chronic health, to acute health conditions as well, but also that it complicates acute illness symptoms and their recovery if they're not detected or managed at the time. And our case study will show you this. Now, one thing that's really important too is understand the influence of stigma when it comes to underdiagnosing and preventing an older person from accessing timely and appropriate care for their chronic conditions. And there's ageism is definitely very apparent in our healthcare system, that older adults face sort of a societal stereotypes, which lead to assumptions that certain health conditions are a natural or normal part of aging, and therefore they don't seem to be managed or treated as effectively. An older person may also have internalized stigma where they may feel have a reluctance to seek medical treatment or have an acceptance that chronic condition is just a part of what they have to put up with as they're getting older. There's also a healthcare provider bias in that some health professionals may consciously or unconsciously prioritize younger adults for treatment options. And we saw that in the COVID-19 pandemic where, there was almost like an expendable attitude toward an older population. That's very broad speaking. Sorry, I don't mean that to be disrespectful. And also the consequences of this stigma is that you very commonly receive the older person is exposed to being underdiagnosed and also has an impact on their quality of life and long-term health outcomes for the older person. As we said before, chronic conditions are more prevalent with age, and you can see from this graph here that the presence of three or more chronic health conditions, affects about 25% of people between 60 to 69 years of age, but over 50% of the people aged over 85 years of age. So we can see that, that stacking up of chronic conditions is quite common. And of course, with the presence of multiple chronic conditions in a person, means that there is a greater likelihood of some of those conditions being less effectively managed or maybe even not diagnosed at all. So the challenge in health and aged care is that, that when there is an issue or an incident or an illness, that takes priority in the management, which naturally it should, and in the clinical assessment. But symptoms of chronic conditions may then be mistaken for maybe a side effect of the acute condition, but also could be mistaken for other illnesses as well. There's a risk of fragmented care and misdiagnoses, as we were mentioning before. And there also isn't a great deal of tolerance or time allowed in the normal routine of medical practice to actually listen to an older person, particularly if there are communication barriers that could be sensory communication barriers or cognitive or language or other communication barriers. And underlying mental health conditions are very commonly overlooked when it comes to managing a patient that's presenting, or a resident, or a healthcare aged care service recipient. Some of the more commonly unmasked conditions of masked conditions, which are basically not well or effectively identified, are heart failure, which can often be mistaken for chest infections or asthma due to breathlessness and fluid buildup. The complications of diabetes are very often underdiagnosed or under-recognised, particularly with its side effects and kidney damage and heart problems, and also sensory changes, as well as peripheral neuropathy and lack of sensation or decreased sensation in peripheral limbs. Cognitive impairment is also very often dismissed as mood changes or temporary delirium, or just a normal part of aging. And for people with dementia, as we were mentioning previously, that communication difficulties does occur in the sequelae of change in dementia, and very often that can lead to the person not being able to communicate their condition and their symptoms effectively, or respond appropriately or effectively to questioning around their health. Chronic pain, for example, as a result of arthritis, can be seen as a new injury, or perhaps not really being recognised as being a long-standing condition. Depression, anxiety, as we said about mental health, is very often mistaken as resulting from everyday stress or changes in life circumstances, rather than there being a diagnosed mental health condition. And vision and hearing loss are very often under reported and under-diagnosed and treated in an older population. Once again, for that acceptance that perhaps they are a normal part of aging, but also that they can be mistaken for cognitive impairment and social, the causes of social withdrawal as well. So there's a lot of conditions that can be very often masked in the older person. So the impact of not diagnosing these conditions is that we get delayed or inappropriate treatments, also increased risk of hospitalizations. We said that accumulative effect, or the consequences of poorly managed chronic conditions, have poorer health outcomes for the older person, missed opportunities for early intervention, things that could be treated earlier before they lead to those acute stages, and the worsening of undiagnosed mental health conditions, and also the risk of polypharmacy, which we'll just go through in a little bit more detail. So polypharmacy is where the person is taking several medications at the one time, often classified as 5 or more different types of medication. And as you can understand, with the increased chronicity, there is also very common for an older person to have multiple long-term chronic diseases, and therefore treatments for them and medications. So the reason that polypharmacy is happening is that each chronic condition is being managed separately. Sometimes person sees different consultants and specialists in different areas of disease management, and so they get prescribed different medications relevant specifically to that condition, rather than thinking holistically. And that there's no sort of regular sort of overview check or audit of medicines. And this is happening quite frequently. There are some programs that do some medication audits, but there are still people falling through the cracks. And as a consequence, there's a high chance of medicines interacting in harmful ways, and that there are side effects of the medications. People might be a bit confused about when to take the medicines, particularly when there are multiple medicines and different frequencies and dosages. The side effects can quite often lead to increased falls and risks of dizziness and tiredness, and also higher risk of acute crises from side effects of these drugs interacting with each other, or perhaps non-adherence to the drugs as well. Now, one thing is myself having been the caregiver of two aging parents right through their palliation, that I have had the lived experience of supporting older people as they traverse the health and aged care system, and it's a difficult job. And if you're in this process yourself, that you can truly appreciate how difficult it can be as a caregiver. And very often the caregivers are aware of other chronic conditions or complications that are causing, accumulatively causing distress and harm and symptoms in the older person. But it's being able to get those conditions recognised and treated without it adding to the burden and the complexity of the care needs of the older person. Very often, when there is an acute episode, the caregiver can feel that their other concerns may not be addressed or they may not be prioritised. And very often also the family caregiver sees an opportunity of an acute incident where a person is hospitalised as being the one-stop shop where they can receive holistic care. And also that they then have the opportunity to be included in care planning, and discharge planning, which is very important. And it's also important to consider that not every older person has a family member or someone close to them who can advocate for them at times when they may not be able to speak or represent their own needs. And so it's also very important for health and aged care providers to be aware of the need for advocacies or advocates or some referral process to ensure that that person's needs and wants are being addressed. Just a quick little case study, just to exemplify how and where chronic illnesses may be undiagnosed or undertreated or unrecognised. This scenario is Mrs. L. She's in hospital. She was recently widowed and admitted to a short stay unit after a bathroom fall, which caused her to receive a wrist fracture. She has a history of osteoarthritis and diabetes, type 2 diabetes, and she has mild memory lapses and no formal diagnosis of dementia. Now, she has recently moved in with her daughter, who reports that her mother's become a bit withdrawn, occasionally loses balance, and is increasingly forgetful, especially in taking her medicine. And the observations when she's in hospital is that she's showing some signs of confusion, and she's very low in mood and has limited mobility, and she does complain of joint pain. Her discharge is planned for later today, as you would expect for a short stay unit in the hospital. So the things to consider in this scenario is what could be happening beyond the fracture, because the hospital's obviously job is to address the acute care need, which was around the hospital, the fracture. But what else might be uncovered in this scenario? And also, what potential opportunities are there for the detection and management of other chronic conditions that may be existing for Mrs. L? And also, how do we involve, excuse me, family in planning her care at home? And we can see from that there is some increased stress and concern from her family. So just some food for thought with that. If you feel, you can place some comments in the chat box if something is really jumping out at you with this scenario, and we'll have a look at those after. So what's some strategies for better recognition of chronic conditions in our older population? Well, some of them seem pretty straightforward, but they're very hard to achieve in our busy lives. One is to really listen carefully to the person's story and look for patterns in their symptoms and how their health has changed over time. And, one of the big things about medical history and speaking to the person and their family is to identify what has changed and what is different. Take a whole person approach and think about more than just the physical, but think also about medical and social aspects of that person's needs. Check for signs that could be overlooked, such as like fatigue and weight loss and pain and reduced appetite or reduced engagement as well socially. Note any mood changes, memory or behavior changes. Um, Also use available screening tools. Now, this may not necessarily be available to family caregivers, but also, primary care is very much an opportunity to be able to do some routine screening for some chronic health conditions that might be indicated through the history and through the family. Involve others who know the person well, as we're saying, and also be curious and not dismissive. So try, challenging your own assumptions and attributions, and perhaps think, beyond just aging as being a potential cause of the symptoms. So some of the key takeaways is that acute issues or assumptions like it's just a fall or just a normal part of aging, they can actually exacerbate and pretty much lead to a hidden chronic health conditions not being identified. A whole person view leads to better outcomes for older adults. And the GP and hospitals are really seen as a gateway to coordinated multidisciplinary support for the older person. It's important to identify and treat multiple long-term conditions and review all the medications, as we were saying before, which helps to maintain health. And really be attentive to changes in mood and memory, which are very often not recognised. And also advocate for the older person and their family to ensure that their needs are met in a really effective way. So hopefully that's given you a little bit of an insight into chronic disease and the older person. As I mentioned before, this is all really just a part, just not just, but the content of a subject, or we call them units, that delivered in the Diploma of Aging Studies and Services. This diploma is the only university undergraduate diploma available in Australia that's specifically focused on aging and studies and services. So it's a great opportunity if you want to increase your skill set and perhaps even looking for professional development opportunities to undertake. It sits within a nest of offerings at the Wicking Centre. You may have heard of the MOOCs. We have several MOOCs. The foundation ones were the Understanding Dementia MOOC, and MOOC being a massive online open course, which is free for everyone to apply to register for and complete. And there's a Preventing Dementia MOOC. And then there are 3 core offerings, which are the Diploma of Dementia Care, the Bachelor of Dementia Care, and as I was saying, the Diploma of Aging Studies and Services, which then can articulate into a Bachelor of Dementia Care if you care to study further. And if you care to study further, again, it can progress you through to graduate certificate, graduate diploma, and Master of Dementia as well. So there's huge opportunities for you to increase your skill set and your professional knowledge and opportunities in the field of dementia and aging. Just a little bit about the course. It's fully online, absolutely fully online. So you could be self-paced. It's got weekly content. So within that weekly content, you can study at your own time, at your own leisure. There are no exams. So we have written and multimedia assessments, but no articulated exams. You can study full time. You could complete it in 12 months, and that it's available to domestic and international students. It takes, there are 2 intakes in a year, semester 1, semester 2, and you can expect for each unit that you'll be studying about 8 to 10 hours a week. And as we showed with the previous diagram, that it's nested within the Wicking Dementia Centre larger subject offering, I love it, larger course offerings. And so there's articulation into the Bachelor of Dementia Care and also the Bachelor of Dementia Care with an aging major. So that's all that we have in the formal PowerPoint presentation today. There's some references, some core references that were used in the presentation today. If you've got any questions or want to share any comments, please pop them in the chat. We'll just take a moment now to have a look at those, and I might be able to respond to some of them specifically. So I'll just stop sharing this presentation. Okay, so I'm just having a look at some of the chat questions. So we've got a bit of time to have a look at some of those. If you feel free to pop some more in if you want me to see if I can specifically address them today. Um, we'll also, sorry, and one thing I will do is we'll take a copy of these, and if we don't get a chance to talk about them today or they're perhaps a bit personal, I can respond to them by email later on as well. Excuse me. A person says here there are many medicines and also had many operations. Sounds like a really complex health history with cancer. Um, and the person is also stating that they're a dementia advocate, which is yay, fantastic. It's really good to have people with dementia having someone to advocate on their behalf, because as I've seen with my parents, my mum did have dementia as well. She was going through this journey that sometimes they'll end up in hospital or at a healthcare service on their own, having been brought by ambulance, and family haven't had opportunity to get there. And it's really great to have someone there to represent them and to understand them and to be able to advocate for them. And also, family members are so desperate to get some support from an advocate, someone who truly understands what they might be going through when they're providing care and support to a loved one who is experiencing dementia, and not only dementia but also other aspects and elements of aging and age-related conditions. Um, okay, I'm just not getting the context of some of these comments. So I'm just seeing if there's something I might be able to respond to. I know that there are many major differences, but I know sorry, may I know what are the major difference between the Bachelor of Dementia and the Bachelor of Dementia Care? They are the same. It's just the Bachelor of Dementia Care is the correct term. A person saying they cared for their mum with Parkinson's and dementia for over 10 years. I completed the MOOC Parkinson's. It was fabulous. Yeah, it's great. I think really, if you really want to dip your toes in the water when it comes to online studies and education, is great to do the MOOCs. There are now MOOCs on multiple sclerosis, Parkinson's disease, traumatic brain injury, and also, as we said, the two on dementia as well, which have just completed a complete revamp and update. So we're always trying to make sure that we're up with the latest as far as knowledge and information around dementia and aging, and so therefore we like to keep the information provided contemporary and up to date. So and engaging. I think that's the really important bit. So you really feel that it's not a burden to learn and share your ideas. There's opportunity to discuss with other people who are studying, and it becomes a little bit of a community. Excuse me, when you're completing the MOOCs. And very often we've actually had quite a few students now that have started their journey with the MOOCs and have actually ended up graduating with their Master of Dementia and gone right through that progression as we showed you earlier. Is it best to complete the diploma in dementia care prior to the diploma of aging? Oh, I don't know about that. I don't think the order of those particularly matter. That they are different courses. both of them can articulate into the Bachelor of Dementia Care if you want to continue studying. It's probably best to start with something that you think is more applicable to your needs, whether it be with your work or your own personal wants as far as to attain education and qualifications in a particular field. If it's more general and to aging, then maybe the aging studies and services diploma may be more appropriate. And if you really have a journey and an interaction with more with people living with dementia, then maybe that one would be more appropriate. Do you need to have a university qualification? No, you don't. We do want some equivalency as far as there's certainly a recognition of your work and experience in supporting older people, and so when you put in an application, that will be considered as well. We certainly with the diplomas are very lenient and flexible when it comes to accepting people into the course as far as their previous educational requirements. We have some really good foundational units that can support people who haven't studied or feeling a bit daunted about going into university studies, that they can do these units as preparation to support them in being able to not only get familiar with the online environment, but also the requirements of study at a university level. Thank you. I think someone's saying that they felt that the webinar was useful and eye-opening, which is lovely to read. Some more information. So certainly place your orders for more information on this chat, but also on the Q&A. But also feel free to have a look at the website and the dementia, the aging email address that we forwarded to you. I could perhaps just bring that up again just so that you know what that is, so that you can send us more questions, and you'll be followed up. Claire will follow up with your link to the recordings and to the slides as well. That's right, Claire. So you'll be have links to being able to communicate further with us and ask more questions. There's plenty of opportunities to ask more questions beyond today. I think that's it. Claire, have we missed anything? Is there anything we could pop in?
Sure. There's one more question. Can I do one subject a year or term, part-time, or is there a set structure?
Oh, good question. Thank you for picking up on that one, Claire. No, you can do one subject at a time, and very commonly that is what happens, because most of our students are more mature. In other words, they're not high school graduates. They have lives, they have families, they have work commitments, and study is sort of ancillary to that. But you know, they need to fit it in, and we are so used to our students picking their way through one unit at a time, sometimes 2 units at a time. Certainly that's an acceptable way to progress through it. Particularly at the beginning, you might not be confident that you're able to put in the commitment of maybe the 8 to 10 hours a week, and therefore you'd like to try with 1 unit first and then feel that you might be able to take on more. Yeah, but certainly in the study, with it being fully online, there's a great deal of flexibility, and even with assignments. I mean, the big driver of your timeline when you're studying is the due date for assignments, and that you've at least completed the content leading up to the assignment to be able to relate what you've learned to your assignments. And even then, you know, people still often need extensions due to family commitments, illness in the family. You know, there's a great acceptance and flexibility around that.
We've just got another question. Sorry, Alice.
Yep.
This person is interested in the Diploma of Aged Care. They're a trainer for a Cert 3 and Cert Individual Support and Aging
Yes.
Support.
Yes, yes, and that this would be a great next step for you. We are looking at articulation from TAFE qualifications through to the diploma, and so that would be appropriate, particularly if you can also present evidence of having worked in the field and having experience. You know, the life experience of supporting an older person and caring for an older person is sometimes the best education that a person can have. And then what we're doing is formalizing that by presenting the theory and the evidence behind your practices in supporting an older person. So yeah, absolutely, that would be a great career pathway for you.
And talking about career pathways, there's another question about what job opportunities would there be after completing a Bachelor of Dementia?
Bachelor of Dementia.
Dementia, yeah,
Okay, yeah. So a Bachelor of Dementia will, hang on, I'm just going to stop sharing this because it didn't actually have the email. Maybe we could just pop the email in the chat.
absolutely.
Yeah. So the Bachelor of Dementia um, is a qualification that's increasingly being put in demand, particularly with the release of our new Aged Care Act, which has now been postponed for a few months, but within the new Aged Care Act and also with the new dementia framework as well, there is a really strong recognition for staff who are in support of people who are aging and living with dementia to have formal qualifications. And although there isn't a this isn't a vocational course. It's not like you do nursing and you become a nurse. When you do the Bachelor of Dementia, you have specialisation in dementia care. And so therefore it increases your job opportunities in roles such as dementia support, dementia advocacy. A lot of local government agencies are now employing people with these qualifications to advise their programs. There is educational opportunities. The government are now employing more people that have formal qualifications in dementia. So there are lots of different opportunities that are opening up. You know, Dementia Australia. Yeah, so there are a lot for profits also. So there's really this is kind of like the cusp of this opening up of really positive opportunities for people that have accumulated some formal qualifications in these topics in these areas.
That looks like it's about it, Alice. Just want to thank you for this fantastic webinar, especially for someone working in aged care residents. And we need to be able to recognise chronic diseases. So that was a
Yeah,
nice comment.
wonderful. Well, on that positive note, I think we should call the webinar to a close. Thank you everyone for participating. Thank you, James and Anthony. I've been seeing you busy typing your responses to people. And also, as we said, with the correspondence that Claire will send out, there'll be further links for you to be able to ask more questions and find out more about the courses. And maybe I'll see you in my class next year or even later this year. Thanks, everyone.